Hello, viewers. You're welcome to our enlightenment program that seeks to enlighten you on your brain and spine health. My name is Dr. Ubong Ekpene, consultant neurosurgeon, the University of Uyo Teaching Hospital in Uyo, Akwa Ibom State, Nigeria, the lecturer with the University of Uyo. In our previous videos, we had discussed issues relating to a symptom called headache. We looked at primary headaches with no underlying illnesses. We also looked at secondary headaches, which had identifiable illnesses related to it, which must not be treated trivially. And we started by considering one of the causes of secondary headaches. We looked at brain tumors. We gave an overview, and we now focused on pituitary tumors, which we said were tumors that grew within the pituitary gland, a very important master gland located somewhere there in the brain of all humans. We looked at the specific tumors that can occur within these pituitary tumors. We started by looking at prolactinoma, which is a functional kind of pituitary tumor that elaborates in excessive quantity prolactin, with symptoms when it is produced in excessive quantity. We also looked at a disease condition that causes excessive production of growth hormone, that we also will consider today the last aspect of it, which is cortisol producing pituitary tumors. It is not a very common condition, but it's very important because when it occurs, it can be very debilitating to the patient. So cortisol producing pituitary tumors occur in between 1 to 2 per 1 million of the population. It typically manifests as a syndrome, which can occur from different causes. It can occur as a result of the pituitary tumor, which we are going to consider today. It could also occur as a result of excessive consumption of steroids, either for treatment of medical conditions or use in cosmetic agents. It also can occur as a result of a tumor that grows within a gland that sits on our kidneys, within this part of our body, the abdomen. It could also occur as a result of tumors that secretes cortisol in different parts of the body, called ectopic tumors. But those are not the ones we are considering today. Today we are going to limit our focus on the ones that occur as a result of excessive production of growth of cortisol within the pituitary gland. So how does it manifest? Cortisol producing pituitary tumors can cause a condition called Cushing's disease, and the typical manifestation is that the patient may present with a round face that appears usually reddened, especially in light-skinned people. We call it moon face. Sometimes they may present with emotional disturbance that may even manifest as psychiatric tendencies. The patient may be seen as somebody who is mentally deranged because of the fact that that is one of the symptoms that they can present with. They can also present with deposits of fats in different parts of the body, particularly the upper back, the abdominal region, causing them to have what is called truncal obesity or centripetal obesity, in which case the hands and legs look small, but the body itself looks enlarged, pot belly typically. Could also present with changes on the skin. We call striae. Those striae are lines that can occur on the skin, appears violet or purplish in color. The patient also may have thinned out skin that bruises easily and also looks friable. They could also present with weakness of the proximal muscles, like the shoulder muscles, the thigh muscles. We call it proximal myopathy. They are also predisposed to obesity, overweight. They look overweight, and also they are predisposed to developing hypertension. They are predisposed to developing diabetes. In females, they may have problems with menstruation. either absence of menstruation or may develop what is called irregular menses. And this also in males can lead to what is called erectile dysfunction or loss of libido. In females too, they can have excessive hair growth in the body called hirsutism. Now these are, of course, they could also develop weakness in the bone called osteoporosis. There are many other symptoms that could manifest, but I just want to limit myself to these symptoms. And if you notice any of these symptoms in your body or in any other person that you know, then it is important that you see the doctor, who will take a detailed medical history and will examine you and carry out some investigations which will involve taking your blood samples to assess if this hormone is produced in excessive quantity. And if that is the case, they will also scan your brain to know whether it is coming from other parts of the body, like we mentioned, or it's coming from the brain. If it is coming from the brain as a result of a tumor within the pituitary gland, then the treatment is to operate, which is to go through the nostrils and to operate and take out that tumor from your brain. Drugs can also be given, and this drug can help control it. Sometimes radiotherapy and even taking out tumors if it coexists in the adrenal glands. These are all treatments that can help you live a normal or near normal life. So I want to encourage you, if you have these symptoms, you know somebody who has it, then it's good to know that there is treatment for it. It's not a spiritual attack, like I always say. It's not a curse from the gods, not a spell that is cast on you. It's just that your body has developed this condition as a result of some problems that may have occurred in the gene or sporadically with no identifiable cause. So when you have such symptoms, present early and you could be treated. Please share this video. You never know somebody who may be passing through this challenge, whose life may be saved. You could also like the video. You could also click on the notification button so that whenever our video appears, you can also get a notification and watch. Thank you so much for your time.